A lot of patients come to me, what happens is they go to their primary care doctor. Maybe their liver tests are a little bit elevated, and the next step is to do an ultrasound. The ultrasound shows fatty liver, and then they come to me and say, well, what is fatty liver? And when we say fatty liver, I'm talking about non-alcoholic fatty liver disease. Your cells in the liver are accumulating fat. Just like anywhere in the body, if you have, depending on your diet, you can also accumulate fat in the liver. The problem is when you have fat in the liver, that fat in the liver, which is called non-alcoholic fatty liver disease, can turn into inflammation of the liver, which is called MASH or steatohepatitis. We have fat in the liver, inflammation in the liver, then fibrosis or scarring of the liver, then cirrhosis of the liver. Not everybody who has fatty liver disease is going to get cirrhosis of the liver, but 1 out of 4 people globally have fatty liver disease. And so that's a big percentage. And so out of those people with fatty liver disease, over 10% can go into that inflammatory process, and then you can go into that pathway. It increases as you age. We have children with fatty liver disease because our diet is not a good diet. We have young people, so in their 30s and 40s with fatty liver disease, because what's our risk factor is obesity. In their 30s and 40s, they come with this, and then I have a group of people in their 60s and they have cirrhosis. And they say, I've never drank in my life. I'm like, I know, but this is because of fatty liver disease. It's one of the most common causes of liver cancer, second most common cause of liver transplantation. So it's like a preventable thing. So I just sort of want to get the message out. Like, hey, if you have it and your primary is like, yeah, everybody has fatty liver. Well, let's really try to tease that out a little bit and see how can we prevent it and not progress. We need to make people aware of this. And so when I have a young person with me and I'm like, okay, you have fat, but we can change this. You don't have to go down this pathway.